Thank you, and welcome all of you. Those of you who joined us for the first two sessions this morning, welcome back. And those of you who are just joining us, I'm Sue Lieberman, Vice President for International Policy with the Wildlife Conservation Society. This is the One Planet, One Health, One Future, moving forward in a post-COVID-19 world conference. This session is One Health and Pandemic Prevention in a Latin American context. We heard some excellent presentations, general discussions about One Health. We cannot have business as usual. What we need to do to have a truly integrated approach from human health, veterinary health, planetary health, the environment, conservation, wildlife. But this session is going to focus specifically what needs to happen in a Latin American context. And I'm going to now introduce, those of you in the participants, please post questions in the chat. We will do our best to relay those questions and ask those questions. More than 650 people are registered for this conference, so we cannot ask all of the questions, but we'll do our best. And hopefully early in December, perhaps the first week, video recordings of all of the sessions of the conference will be made available to all participants. I'm now very pleased and honored to introduce Dr. Nicole de Paula, who is the inaugural Klaus Töpfer Sustainability Fellow at the Institute for Advanced Sustainability Studies in Potsdam, Germany, where her work is focused on sustainability, environment, and public health. And she champions the socioeconomic advancement of women through environmental conservation, public health policies, and is the founder of the Women Leaders for Planetary Health. She's a native of Brazil and holds a PhD in international relations from Sciences Po in Paris and has been consulting with several international organizations. And her recent research focuses on decision-making and international cooperation in the post-COVID-19 world. And we hope the post-COVID-19 world comes very soon. So Dr. de Paula will introduce the session and moderate it as well. Thank you. Nicole, the floor is yours.
Thank you, Sue. What a pleasure. And we all hope this post-COVID arrives so that we can move our titles of our research, right? So hello, everyone. Thank you for tuning in. I know your Zoom time is so valuable. So I'm very honored to have your attention this afternoon here for us in Berlin. Being from Brazil, of course, it's truly exciting to contribute to this session dedicated to One Health and pandemic prevention, specifically in Latin America. So I want to start by saying that we're all pioneers here. We launched, looking back, there is one scene from the World Health Summit last year here in Berlin that also happened very close to our conference that we talked this morning. That really kept in my mind is there the World Health Organization Director General, Dr. Tedros, he said at the opening and said a pandemic is not a matter of if, but when. And then just a few months later, we were in this situation. So I'm coming from the field of international relations, but since I got directly connected, involved with the theme of health and environment and these connections, I heard this warning many times. So when COVID-19 hit us, I must confess that I felt a little bit prepared, at least a little bit. And we know that such an event was surprising perhaps in scale, but not really surprising if we were talking to these people in our circles. So we had the information, we had the science showing these growing risks of pandemics, and we know that our impact in our natural world has a lot to do with these growing risks. So the message that we have been trying to convey now for years makes much more sense today. Indeed, there is no healthy people in a sick planet. But for the first time, people around the world, we are together, not learning about these risks of these pandemics, but we're feeling it. And I think that makes a difference. I moved to Germany in 2019 from Southeast Asia. And my first week here started in a very strong position with so many events on planetary health and One Health. So it was really inspiring and to see the solid interest and then powerful networks already operating here to combat pandemics, to scale up the implementation of One Health. So I would like to congratulate the organizers of this event, the German Federal Foreign Office and the Wildlife Conservation Society for inspiring the right debates in such a timely manner. Giving the opportunities to rethink these rules of reality we're living in, we might ask Is COVID-19 more of a crisis or an opportunity to rearrange our priorities here? At the same time, the theme of the conference seems very straightforward and obvious sometimes for all of us, because yes, we are, of course, one planet, one health, and one future. But to move forward in this post-COVID-19 world, a lot needs to change. And most of this change has to do with the efforts to combat these fragmented governmental structures, these academic departments that are completely acting in silos, and perhaps even our mindsets. So moving to our specific topic here, I believe in COVID-19 in Latin America has unfortunately a different flavor. It has this strong taste of real inequalities. And according to the UN, we see that COVID-19 will result in the regions of worst recession in a century, causing almost 10% of contraction in regional GDP. The consequence of this is, of course, a number of people will be moving again to poverty and extreme poverty. We're going to see problems and new risks and food insecurity and other health problems. So we're now moving what we're calling not a pandemic, but a syndemic, this multitude of crises together. I know I mentioned the GDP, but the problem is how can we move away from these methods that measures our economy's performances by ignoring these environmental social externalities, something that we touched on the beginning of this conference. So if you talk about inequalities, around the world during this lockdown, it looks like we are on the storm, right? But if you were in this ocean, we were perhaps navigating with different boats. And we all know that before even scientific papers were able to quantify these inequalities, women knew who was really suffering a disproportionate burden of this pandemic. I'm sure many on this conference could identify. When you have more than 70% of women working on the front line of the healthcare professionals and responding to these new viruses, gender inequalities became even more evident. So we all know that I'm not even bringing this topic of domestic violence that we saw around the world, not only in Latin America. So really sad topics that bring so many crises together. So in light of this bleak scenario, we know that we need long-term planning. But in Latin America, that perhaps we're not the best at planning in the long term. So we need to really get ready for this. If we're trying to finally a point is the importance of the global South. I'm convinced that Latin America in particular, but the global South in general, we can not only be perceived as the source of the problems. These regions have relevant examples of resilience and adaptive skills. And I would love to hear examples from that from our panelists. So finally, perhaps I think we do not necessarily need to build back better, but we need to press a reset button here that can allow us to promote a real global Green Deal. To do that, we need powerful brains and doers here. So we're very privileged to have these committed individuals for this panel today who will help us to think, how can we promote social ecological resilience? I would like to share some highlights of this professional journeys of our distinguished panelists. Since our time is short, I'm only sharing a tiny fraction of your long accomplishments. And I'll start with Dr. Sarah Olson. She's the Associate Director of Epidemiology of the Wildlife Conservation Society, the health program. She provides leadership and research support to the field veterinarians and conservation staff around the world. Her job is to help understand and mitigate the conservation impact of wildlife health threats and zoonotic diseases. So Dr. Sarah did her PhD in Latin America, and she will speak on land use, deforestation, and human health in the context of COVID-19. I'll introduce also our second speaker, Professor Braulio Dias, who is Associate Professor at the University of Brasilia in the Department of Ecology. He has previously held various positions in the Brazilian Ministry of the Environment, including the Research Director of the Brazilian Institute of the Environment and Renewable Natural Resources, what we call our IBAMA. So you're also Director for Biodiversity Conservation since 1999 and National Secretary for Biodiversity and Forests for 2010 to 2012. And of course, between 2012 and 2017, Professor Braulio was the Executive Secretary of the United Nations Convention on Biological Diversity. So welcome to both of you. I'll introduce our other participant who will address us via video. With that, I would like to invite Sarah Olson to share her initial inputs. Thank you very much.
Thank you so much, Nicole, and hello to everyone. My thanks to the host of this event and everyone participating in today's session. I'll be talking about land use, deforestation, and human health in the context of the present pandemic. So I've been a researcher in this interdisciplinary field of disease ecology for over 15 years with a PhD that focused on deforestation and its effects on human malaria in the Amazon. So here are the three ideas I want to share today. First, degradation of ecosystems has complex effects on diverse aspects of human health. Notably, the degradation of ecosystems is happening on a huge scale. Some earlier speakers referred to this today already, but 75% of the terrestrial and 66% of the marine environment have been severely altered to date by human actions. And predictably, this degradation is having effects on diverse aspects of human health. Second, ecological degradation alters infectious disease dynamics in wildlife hosts and increases human-wildlife contact, greatly increasing the overall threat of zoonotic disease outbreaks that are originating from wildlife. Third, preventing deforestation is a highly cost-effective intervention to avoid another COVID-19. So let's start from the 10,000-foot view. We're in a situation where human activities have broken down natural zoonotic disease barriers, shaken ecological systems, and exposed the world to greater infectious disease risk. The good news is we can repair those natural barriers and gain numerous human health benefits. At a very fundamental level, I think we can all agree biodiversity is essential to human life on Earth. The WHO captured this in a 2015 review of the subject, and this report covers everything from the air we breathe provided by trees to the water we drink, with wetlands providing pathogen filtering services, to the food we eat, as well as mental, physical, and cultural aspects of daily health. So I'll be talking about forests today, but keep in mind these connections apply to other biomes. For instance, in marine systems, nutrient pollution causes harmful algal blooms and dead zones, and degraded savanna grassland systems compromise livestock production. So here's one example of intact forest and its impact on the second leading cause of death in children under age 5, diarrheal disease. Using data from 35 developing countries highlighted in a map, researchers found a 30% increase in upstream tree cover was similar to the effect of improved sanitation on reducing childhood diarrheal risk. So healthy intact forests support childhood health and can lower water treatment costs in downstream urban areas. Now let's turn our attention back to the current pandemic and the connection between environmental degradation and zoonotic disease outbreaks that originate in wildlife. Various pathways and mechanisms lead to increased human exposure to zoonotic pathogens. One of the most recognized links is change in land use and its influences on contact rates between people and wildlife. This graphic from a study of forest fragments around Kibale National Park shows how this process happens, but it's the same process in Latin America. As you increase forest edges, human-wildlife contact increases as well. And the impact of degradation is then multiplied by activities that lengthen the edge between intact areas and people. These activities include road building, logging camps, and the expansion of the human footprint. So if we halt degradation, we can reduce contact and pathogen transmission. But it's not just contact rates that are impacted by land use change. Infection dynamics are altered as well. And this infographic covers the basics of what drives infection dynamics in reservoir hosts. Viruses naturally circulate in wild animal hosts. Stress is introduced by ecological degradation and affects host resource distribution, movement, host population size and density, as well as host reproduction, which in turn impacts host behavior, co-infections, and susceptibility. So ecological degradation is an environmental stressor that can alter infection dynamics and increase viral shedding. Once a virus is shed into the environment, it has to overcome numerous within human barriers, which aren't shown here, but that allows it to then, if it can achieve that, it then can effectively spill into a human host. And if the pathogen can infect more people beyond the index case, then it may be able to establish and then sustain human-to-human spread, as we've seen with COVID-19. Obviously, the way to stop this cascade of events is to prevent the ecological degradation from the get-go. So there are a number of case studies of pathogens, viral pathogens that have originated in wildlife showing how they are associated with ecosystem degradation and anthropogenic activities. It boils down to activities that alter disease dynamics and influence the edges between wildlife and people. Beyond case studies and observational research, modeling groups have used different approaches and techniques to reach the same conclusion, that degradation increases zoonotic disease risks. So this is a figure from a study that looked at forested land conversion and projected epidemic size. Basically, you can see as intact forest, shown in green in the bottom kind of mini example landscapes there, is converted to other use, shown in yellow. the average size of the projected epidemic increases until so much land is converted that the average size of the risk declines again. In other words, risk peaks at intermediate levels of habitat loss, and this all comes back to how degradation impacts disease contacts or impacts the contact between wildlife and people and disease dynamics. So is prevention affordable? Yes, it is. The first economic analysis came out earlier this summer, and it shows just how affordable it is to prevent deforestation. The authors reviewed the cost of policies that reversed the deforestation trends in the Amazon between 2005 and 2012, and the amount of zoonotic high-risk tropical areas. And just to note, a lot of those high-risk zoonotic tropical areas are in the Amazon and Latin America. And the price tag to protect 40% of forest at the highest risk for spillover is about $10 billion annually in direct payments. Another option would be to simply remove existing subsidies at a cost of $1.5 billion annually. But better yet, they actually start to pay for themselves when you cost in the ancillary benefits of reduced carbon emissions. So the planet literally comes out in the green with $8 to $17 billion in carbon benefits from these interventions alone. So we're not even considering other cost savings like those from reducing diarrheal diseases in children. Meanwhile, the current pandemic is certainly an outlier, but damages are estimated to range in the tens to trillions. So I'll just end here and leave time for the other panelists and provide some additional resources. Thanks.
Thank you, Dr. Sarah. This is really fantastical to listen that prevention of this problem is affordable. So this is a clear solution, and this idea that good news that we can repair these problems we were talking about, right? And it's just about channeling the right resources to the right topics. Thank you so much for these concrete examples. And I think I would like to now invite Professor Braulio to give his contributions, and then we're gonna have another continue this conversation. Thank you, Braulio. The floor is yours.
Thank you, Nicole. Hello to all. I'd like to thank the organizers for the invitation. I think the discussions like this are very important. Unfortunately, most people are not aware of these interlinkages between nature, biodiversity, human health, and also the risk of zoonotic diseases moving from wildlife and from domestic animals to humans. And unfortunately, in a country like my own, Brazil, our government doesn't accept the science behind this and doesn't realize the risks of this pandemic and how it originated and what is needed to prevent the recurrence of other pandemics like this. But the reality, those that study the issue know that epidemics and pandemics are a part of life in the world. We have experienced a number of these over the years. In the last decades, there have been many affecting human health in all continents. And many of these have been proven to be directly related to nature degradation and people moving into natural habitats and having contacts with vectors of diseases that so far have been confined to natural environments. And here in Latin America, we have the privilege of having perhaps almost half of all the tropical forests in the world and many other natural ecosystems like savannas, grasslands, mountain areas, etc. And this is a host for a very large biodiversity richness. And of course, among this biodiversity, we also have diseases and vectors of diseases. So far that as far as these natural ecosystems are conserved and are kept in more natural conditions, there is a lower risk of new epidemics and pandemics starting based on the diseases that exist in our natural ecosystems. We have in Brazil a long tradition of studying tropical medicine and the epidemiology of diseases. In the Amazon, for example, we have a specialized research facility just studying the virus of the Amazon forest. They have been doing this since the 1940s, and there are thousands of these viruses in our forest. So if we are not careful enough, the Amazon forest, for example, but not just the Amazon forest, other natural ecosystems, can be the origin of new epidemics and pandemics. And so this is a real risk that we usually don't consider in our public policies. A major problem in our public policies, not only here in Latin America, but all over the world, is that governments are organized by sectors. So we have sectoral policies, sectoral institutions, sectoral budgets, sectoral laws, and these sectors usually don't talk to each other. So there's little coordination among, in terms of the work done by the different sectors of government, and that's what we need to really get a grip on this problem and reducing the risk of new epidemics and pandemics. And Sarah indicated very clearly how many of these emerging diseases start from nature degradation. There are many others. She mentioned the algae bloom associated with pollution in coastal zones. And we know, for example, that cholera outbreaks are a usual outcome of these conditions. And there are many, many other examples. And she mentioned the recent study by Dobson and others on the economics, how much it costs, what is the cost of a big pandemic like the current one, and what is the cost of protecting nature and preventing new epidemics and pandemics. The cost difference is huge. It's much more cost effective to conserve nature, prevent new pandemics, than facing the risk and paying the cost, the human cost, the economic cost of new pandemics like this one. And remember, this pandemic, we can say we're quite fortunate that the mortality rate of this pandemic is quite low. There are other epidemics with mortality rates above 50%, for example. Imagine if we get a new epidemic with high transmission rate and high mortality rate. It could devastate human population everywhere. That's a real risk we're facing. And the best way to deal with this problem is prevention. And the best way to prevent is to take care of nature. So we really need to enhance a better coordination in terms of public policies. The medical sector has a tradition of treating illness, and we need to emphasize more the need to prevent illness and to keep people healthy. So that's a change, a shift in attitude in the medical sector that we need to promote. And we need to enhance the cooperation. So One Health speaks for this, the need to better coordinate human health with the health of wildlife and the health of domestic animals. And we're still not there. So there's a need to enhance this much more. We have a lot of research that we can make use of, but of course, each new epidemic is different, and we have to, there's a learning curve, just like this one. So, of course, there are some general lessons that we can take into consideration as we develop our policies. And I think in Latin America, there's a big challenge for us to go in this direction, especially because of many governments that don't support science and don't understand that public policies needs to be based on science. But I hope this will change. Thank you.
Thank you so much, Professor Braulio, for bringing this questions of that prevention. Again, is much more cost effective than waiting for paying, the damage that we are seeing nowadays. I just want to have a follow-up, very quick question, because I think everyone is very curious to have a feeling of the political context in Brazil. And after the elections, perhaps the world gained a little bit of hope that these topics with the science would regain perhaps a little bit more space. Is there any sense of this feeling in Brazil that now science could get a little bit more space in this context? Or how is it, what's your feeling? Is perhaps a good opportunity with this COVID? What's the national context in terms of this politics?
We hope so, Nicole. We just had municipal elections throughout Brazil, and there was no support for politicians from the radical right that do not recognize science. And so the interpretation of experts is that the voters have supported common sense politicians that can really deliver on policies that can really benefit the population, and not just the message of negating science and promoting hate, as we have been seeing in recent times here in Brazil.
Thank you so much. I think that's really the part that we are talking about, is leadership, how important it is to promote the One Health approach and combine and break in the silos in the government, and not only in the government, but also even academic work, right? We see how you're talking about this transformation, and the groups of medicine, for example, calling for these teachings and including ecology, for example. This is an encouraging sign. And I think we can talk about during the debate, but even our University of São Paulo showing some beginnings and this more transdisciplinary, interdisciplinary work. I would like to
sorry, Nicole, and we want to benefit from the spillovers of the elections in the US to benefit politics here in Brazil.
Exactly, and that's why I think it was a good question to pose, because I think more than the U.S., I think many countries could gain from these results, and it's good to enjoy a little bit of hope here, right? So I would like to invite. We have now a video presentation from Dr. Alejandro Gaviria, who is the president of the University of the Andes in Bogotá. And after having served as a dean of the School of Economics at Los Andes for 6 years, Dr. Gaviria was nominated as Colombia's Minister of Health and Social Protection, where he stayed there for 6 years. And after his time working in the national government, he returned to the Andes as director of the Center for Sustainable Development Goals for Latin America, until he was elected the president of the University of the Los Andes for a 4-year period starting August 2019. So if we're ready, we'd like to watch his video intervention. Thank you.
Good morning and good evening to everyone. It's a privilege for me to share my views about my practical experience with environmental health and with this important idea of One Health. I am an economist who has devoted a good part of his life to study socioeconomic development. I spent many years of my life studying the social determinants of health. I was appointed Minister of Health of Colombia in 2012. I was minister for 6 years, from 2012 to 2018. I had the humbling opportunity to try to implement all that I had recommended. Policy making is an exercise in frustration. You learn too soon that your powers are limited, that social change is complex, and that therefore you better find some pockets of possibility. I'm going to give you a few examples of my experience on the ground. These examples are illustrative in my opinion. Probably it's going to be very difficult to draw some general conclusion from them, but all in all, they underline the political complexities of the issues at play here. With this introduction, let me get started. As Minister of Health of Colombia, I had to cope with the epidemics of chikungunya and Zika. I felt powerless many times. I remember that I tried to explain in Congress that these epidemics were related to environmental problems well beyond our policy space. But that connection, I must confess, was very difficult to make. I sounded many times as if I was making excuses. My efforts to coordination and cooperation with other ministers were not very successful, I must confess as well. We created an intersectorial commission for health. The environmental minister attended the first session, but then delegated to other people. In 6 years, I had only one bilateral meeting with the environmental minister. Public policy in practice takes place in silos. This is difficult to change. Probably it needs a commitment from the top, from the president. Effective coordination is not the only issue to resolve here. In practice, there are also many political economy challenges. Latency periods are long. Empirical analysis of these topics is difficult. Longitudinal studies are only suggestive, and industrial lobbies know very well how to use scientific doubts to their advantage. I experienced these problems firsthand. An attempt that I made to implement a soda tax was disrupted from the beginning after an aggressive media campaign orchestrated by financial conglomerates. The debate was not even allowed in the Colombian Congress. The political economy, as I said, is complicated. There is also, I must acknowledge, some indifference of the general public about these issues. Mercury contamination is a huge problem in many communities in Colombia. Some studies have shown deleterious effects on health, but nobody seems to care, nobody. I say this as a form of self-criticism. Environmental health can be set aside too easily with few political consequences. This has to change. But I don't want to be overly pessimistic. Oftentimes good policies can be implemented. Oftentimes we can make the difference. We were able in Colombia to stop the fumigation of coca fields with the weed killer glyphosate. We made the connection between environmental degradation, lost livelihoods, and the direct health effects, dermatological and respiratory problems, as well as a probable connection between a repeated exposure to glyphosate and cancer. The Constitutional Court in Colombia backed our arguments. The environmental authorities acted in accordance. Fumigation was suspended. There are now mounting pressures in the country to resume them, but our arguments that somehow encompass the Berlin principles have prevailed so far. I am an advocate of piecemeal social engineering. We need a good normative foundation to trigger social change. I repeat, we need a good normative foundation to trigger social change, but ethical principles are not enough. We also need social norms, brave leadership, and good science. My experience shows, I guess, that there are many forces out there that inhibit social change. We lose some battles, we win others, but we have always to maintain a bias for hope. We have no choice. Thank you very much.
Hello, everyone. Thank you once again for this inspiring video and message that started with a little bit of a pessimistic note. It's, of course, we know the disconnections between policy and science are not the easiest, but and with the problem of always the vulnerable communities that ended up suffering this impacts of our inaction, something that's why the social norms and these issues of inequalities must be addressed if you want to really implement One Health approach. So we could now have, I would like also to note that our We have our Honorable Andrea Meza Murillo, the Minister from Costa Rica of the Environment and Energy. She was supposed to be with us today, but she sends her apologies. But we are very happy that I'm sure she will be following this discussion. And Costa Rica has been also a country showing leadership in this field of environment and health. So I would like to come back and maybe have a short conversation. If you have questions, please send us in the chat, and we'll try to address some of them. And so for you, I think I would like to open this discussion, this point of, we talked a lot about leadership and how important, for example, the building principles, but we need to implement these things that we're building. And one of the aspects that we're going to have a panel, I think, tomorrow about this, but I would like to have a sense of, and perhaps you, Sarah, we have some experience with what is the role of multilateralism in this context, right? And if you have to have this ask as a researcher and working in this science policy interface, what do you see any change in these agencies? How international organizations are responding? I know the Alliance for Multilateralism perhaps has examples recognizing further the need to push this One Health approach to the policy level. Could you share some reflections on this for us? Thank you.
Yes, thank you, Nicole, and thank you for that great question. I think it's really valuable to take these multilateral approaches, and I'm really heartened that this conversation is reaching those levels. I was invited just last week to help bring in and kind of ring in a high-level expert panel on One Health at the Multilateral Forum. And so I see movement there, and I see, I've been working in this space since a graduate student in 2005, and, and there's a lot of energy as a student, and, 15 years later to see this trickling up to the policy levels where we are reaching these multilateral platforms, and there's uptake and there's recognition that not only do we need to integrate the sciences, but we need to integrate the different departments, the Ministry of Health, the Ministry of the Environment, Ministry of Forestry, all of these people need to come together. And if COVID was there to just kind of motivate and push this over the tipping point, if we were pushing that uphill really slowly, but, maybe, this opportunity we can, not to say we're taking advantage of it, but to use it to motivate and to accelerate this push to bring One Health and to kind of multilateral areas.
That's a very important point. As a student, we start with a lot of energy, right? But these topics take decades to evolve, but they do, and we cannot give up. We need to continue pushing. That's also our role of communicating these issues effectively so we can move forward. So Braulio, do you have also, of course, you were at the heart of the multilateral scene, and we heard today how biodiversity is so essential in this crisis, and even the connection with the climate emergence that we hear a lot, and we have, of course, the youth movement. We still don't see, now they're connecting perhaps more these two issues. So how do you see this difference? Are we evolving in the right direction in terms of recognizing this need to really connect these two agendas at the multilateral level, especially climate and biodiversity?
I think we're seeing some movements in that direction, but still very slow. The same criticism I made to how governments are organized by sector can be made to the UN. The UN agencies are sectoral, and we don't have many platforms to bring together the different agencies, the different governments to work together to set new policies, to better coordinate policies. So in September 2015, the UN General Assembly adopted the 2030 Agenda for Sustainable Development with the 17 SDGs, and they established a high-level policy forum to supervise and coordinate this whole process. So far, the role played by this high-level policy forum has been very modest. So they have been listening to reports sent by governments on what they're doing to implement the SDGs. I must say that the SDG, there was a big effort to try to link the issues. So if you look inside each of the SDGs, and if you look at the targets inside each SDGs, there are targets that makes the links between the different issues. So that's good, but still not enough. We have several emerging informal fora that bring together actors from different sectors, but they have no decision-making role, but they can help. For example, FAO created a forum to promote the mainstreaming of biodiversity in all sectors of agriculture, including fisheries, forestry, etc. So this is good, but it's just a forum for exchange of information, right? And decision-making are still made in sectoral fora. So that's a big challenge. And we had discussions on this in Rio during the Rio +20 conference on sustainable development. And there was a push, for example, by Akin Steiner and others, that we needed to promote a new global governance for the environment. But this was not broadly supported by governments. So we didn't get that in the end. So it's a process, and hopefully we will see more changes over the years. So we have to understand that this is a slow process. It will take time.
Exactly. It's a slow process, but we're moving forward a little bit. Perhaps now, as I said, with the feeling of the pandemic and the lockdown, we might see this change. I see at least a few differences. This environmental agencies now opening for the health dimension that before, maybe 2 years ago, they would say, no, we don't do health. And then you go to the environmental, it's that we don't do environment. So, and the same for gender, I must say. If you talked about, you need to connect this crisis, right? But the agencies are still organized, and this has in the silos, but has a lot to do with this also, the budget and the finances. I would like to take a question from our chat here. And so we're saying one thing that is overlooked is internet health and the toxic effect of Facebook, perhaps other social media, and on the acceptance of science. Fact-free musings, coronavirus deniers, so all of the fake news, right? So education is very important, but it takes time. Is the solution to work in many places locally? Do you have our panelists, we talk about infodemics and how we're dealing with this question of fake news, and social media is of course problematic on the side, but it can also mobilize for the positive, right? We're sharing good information, depends where you're consuming. How do you feel about it? And do you see, I think, Sarah, perhaps it was also linked to that discussions of multilateralism, and Braulio, do you have a feeling of that? Are you feeling that this is really a problem for us?
I would say, yes, it is a problem, but internet, social media has the same pros and cons as the normal communication means that we had in the past, the face-to-face meetings, etc. So we always had fake news in the past, even if we didn't have that expression. But it's with the internet, it transmits much faster. And there's a lot of research showing that people prefer to transmit bad news than good news, unfortunately. So maybe that's a human behavior based on our history, our evolution, when we had to pay attention to any information from the environment indicating that a lion might be hiding behind the bush. So bad news always receive more attention, unfortunately. So this affects the way people perceive the issues. And there are studies showing that if you ask people how the environment is, where they live, in their province and in their country and at the global level, it's quite interesting, the results, which are common all over the world. People used to say that the environment and other issues in their neighborhood is good, but as we move up the hierarchy, the pessimistic views tend to predominate more and more. This is again perhaps human behavior, and people don't have good access to information about what's going on at the global level, at the national level. So they just extrapolate, or they just believe on everything they receive from the internet.
Exactly. So Sarah, do you share this feeling as well?
No, I think it is. There is a problem with the infodemic and social media and how people get information. And I also think there's a loss and appreciation for just good science education. I think that's also been noted, that people don't know what's real science and what's not. And they're easily kind of maneuvered, as you say. They're more, sensational news and bad news travels much faster than the basics and the hard work that science has to do. I think it takes both. I think the commenter, it needs to come from the bottom up, but from the multilateralism approach, it needs to come from the top down, that leadership. We need to have those multilateral agencies leading and pushing forward in this space so that other, nations can follow, and then, states can follow, or provinces can follow, all the way down to my county. We need to kind of work at all of those levels. I think Chris put that picture up. We need to work across scales when it comes to moving this forward. It's about getting that momentum, and you can't get momentum if you're just working at one scale. You kind of need to put everybody's hands on that target to make it move. So I think, yes, it's a problem. Yes, there's lots of places to move, but we can start at all levels. It doesn't just need to be from the bottom up to work on this.
It would be good if countries would establish minimum requirements for politicians wanting to run for office. So we could test to what extent they have a minimal science understanding, etc.
Exactly, we're going to establish a new science. But I wanted to bring we have 4 minutes left here. But there is I was in December last year, I was in Congo, in Brazzaville, and then on a training exactly on the operationalization of One Health. And if you go, and the reality is that this decision will have to be taken at the national level, right? We need to train and this the officials in these different ministries to work. So do you have examples of countries leading this capacity building for One Health? Because there are tools, and of course it needs to be contextualized, and this is very important. We talked a lot about the global level, but in the end, the national context is so important. Do you have any success stories of coming from Latin America or the global South? I was, for example, seeing in Africa, for example, how some solutions that, and people are much more also exposed to this, to the epidemics, and perhaps more prepared for this response. And I know that Brazil, Braulio, you have the example, I know from Fiocruz are acting on this. And then I don't know if Sarah also would like to conclude. This might be perhaps our last question. And maybe Sue, we can also end with your feelings about this, how this scenario in the US could change our visions here. So, Braulio.
Sure, there are many good examples. Most of them are local. A few are of national extent, but we need to upscale and multiply these good examples. Here in Brazil, for example, there's an online monitoring system to detect information about zoonosis, animal diseases occurrence, and to alert the medical community about potential new outbreaks coming in. So that's quite interesting. This is maintained by the Fiocruz, the Oswaldo Cruz Foundation, which is the main tropical medicine research institution in Brazil. So that's a good example. And there are some local initiatives of people from the medical sector in Brazil working on helping local communities to solve environmental problems. Where the population is suffering from pollution and other issues. So there are some good examples, but we need to promote much more of these and upscale them.
Sarah, would you like to also share some examples?
Well, you just mentioned Brazzaville. I do a lot of work in Republic of Congo, and there we're working closely with communities. So we have a team that goes out and they do awareness raising about Ebola risk factors, and don't touch things that you find dead in the forest. And we work with them to establish a surveillance program where we come and we test carcasses that villagers find, and we can relay that information. This is, we haven't found a positive carcass so far, and knock on wood, but this information is then connected and brought into the National Ministry of Health, and it's used to kind of coordinate and inform the population. So it's a conservation organization working together in partnership with the Ministry of Health to get this outreach, and to also, on our side, we know that gorillas are just as susceptible to Ebola as people, and so it's a mutual kind of space where we can work and move this area forward. So you just need to find those small kind of examples and work at the systems level and figure out what the solution is for a particular need. But there are these bright spots and there are these nuggets out there. We just need to start putting more of them around the world.
Thank you, Sarah and Braulio. And I think it's exactly, we need to keep moving forward. And to be honest, I don't think we have an option. It's of course, sometimes very hard, but we need to keep moving forward. I'm so thankful for your examples, your courage to work transdisciplinary, move this agenda forward. And we could close. And we have a question also that someone asking, I would appreciate to hear it from the panelists, what they think could be the effect of the new administration in the US for science-driven decisions at the multilateral level. So perhaps, Susan, you could come us and close this event saying your personal feeling. This was a long debate today. We'll continue tomorrow. So are you more positive at the end of this these discussions, or how do you feel about this?
Thank you. And thank you, Nicole, again. Thank you, Nicole, Braulio, and Sarah, as well as Alejandro for his contribution, his heartfelt feelings and the challenges he faced. I really appreciate the input. It's just the beginning of the conversation. You asked, there was a question asked in the chat. I'm very confident. I love Braulio's term that with the election in the US, maybe there'll be the kind of spillover that we want. And in the US, I do predict much more policy making that pays attention to science. We have no choice but to pay attention to science, or we're going to be where we are now in terms of ecosystem collapse and a global pandemic. But I'm very optimistic that the new administration that will come in January is already listening to science and taking policy decisions based on science, but also engaging at the re-engaging and leading at the multilateral level, whether through the WHO or even the US and the CBD, one can hope, but one can always hope. But I am very optimistic that we'll see that. But I think several of you said this is going to take a long time. We don't have a long time, and we have to scale this up and speed this up much more than it has ever been. We can't sit around and talk about 2030 and hope we get a little bit of improvement by 2030, or we'll have another pandemic and another COVID on our hands. So, but I really appreciate the positive discussion. There's a lot more room to discuss, and we had a lot of questions specifically on Latin America, but we don't have time for all those questions. I do want to say that the recording from this session will be available hopefully the first week of December. I thank the speakers again. This was fantastic. I want to thank all of the participants who were with us for both sessions in particular, and look forward to being with you tomorrow at 8 a.m. Eastern time and 1400 Central Europe time, where we will discuss some specifics with some great speakers on an African context, the Asian context, and then we will explore that issue of multilateralism even more. Thank you again, of course, to our tremendous support from the German Federal Foreign Office, and thank you to all of you.